still waiting for your questions. Dog is around to answer all your questions. So you send it to me for him to answer. We're waiting for your questions.
Okay. So I think for now, I would just like us to talk about ectopic pregnancy and illegal abortion. I think it's one of the most dangerous things, especially related to ladies, women, and married couples as well. It's one of the easier, I won't say very easy, but one of the most simple things to manage. Yet, if it's not done right and by the right people, can always end up in some fetal or near fetal conditions, especially to ladies. So to start with, we'll talk about ectopic pregnancies before we come to the, how do you call it? Sorry about that. Before we come to the illegal abortions, because the outcomes of most abortions sometimes as a result, especially the very bad ones, as a result of whether the pregnancy being an intrauterine or being an ectopic one. And that's the reason why I want us to talk about the ectopic pregnancy before we go to the abortion. So with ectopic pregnancies, the issue is that most, for any normal pregnancy, the fertilization will start from the tubes. And after fertilization, the embryo has to move from the tubes into the uterus. It has to be intrauterine, and that's the normal place where, how do you call it? The normal place where any baby is supposed to develop. So any embryo that is developing into a fetus that is outside the uterus, outside the intrauterine cavity, is what is termed as the ectopic pregnancy. There are some of them that can be found at the ampulla of the fallopian tube. Some can be even at the fimbria. Some can be at the isthmus of the tube. Some can be at the cornual site just before it enters the uterus. Some can even be as far as the cervix. And then we can also have some being in the, maybe if there is a previous CS scar, sometimes the embryo can go and lodge over there as an intramural ectopic. We can also have an abdominal ectopic pregnancy. But in all of these, the only normal one, usually, the usual place for any fetus to develop has to be intrauterine. The intrauterine one is the most important, and it's the best place where, because that's the only place where the developing fetus can get all of its nourishment from the mother. In any other place, the baby, whether it is getting it or not, will not have the adequate nutritional support, adequate space for its development. And so for a pregnancy that is somewhere in the ampulla or infundibula at the isthmus of the tube, at the cornual site, at the cervix, because the baby is not going to get adequate nutrition and that site is not made for the baby to develop, usually what will happen is that it will rupture after some weeks. So some of them will present to the hospital probably with some sudden collapse that was by severe abdominal pains. They come and they are looking paper white. They are feeling dizzy, they can't stand, they are not able to eat, they are holding their abdomen. You do the necessary investigations, such as the abdominal ultrasound, or maybe a simple tap with a syringe in the abdomen, which is not always the ideal one, but in some settings where you are forced to do it, where you don't have a scan and you are suspecting an ectopic pregnancy, it might come as a diagnostic measure for you to diagnose a ruptured ectopic. And this becomes an emergency when you have a ruptured ectopic. In that situation, you have to be in the hospital in the next 5, 10, 15 minutes to be operated on, because till you are operated on, that ruptured ectopic you have is going to cause you to bleed, and it won't stop by itself till it's taken out and sutured. The person is going to continue bleeding, and sometimes they come to the hospital and they have very bad anemia because it started probably leaking some days prior, and the person didn't pay much attention to it. And so that's the reason why these ectopic pregnancies are of much concern to us, and we always have to be alert and be on the lookout to make sure that these ones are seen as early as possible before they rupture. And if anything has to be done about it, it is done at the appropriate time, and you are receiving the appropriate care before we get any fetal conditions happening. On the other side of this ectopic pregnancy is the abortions that I wanted to talk about. The issue with abortion is that legally or formally, if anyone is doing it, the person in a proper hospital setting is always requested to take an ultrasound. Now, the reason why you are requested to take the ultrasound is to ascertain whether the pregnancy you have is an ectopic pregnancy. First of all, is to find out whether indeed you are pregnant, there is an embryo formed, whether it is an intrauterine pregnancy or an ectopic pregnancy. There is no doctor who will see an ectopic pregnancy and manage it like it's an intrauterine pregnancy. The issue is that with the ectopic pregnancy, if any health professional is going to perform the abortion for you, what we know is that either with medication or with vacuum aspiration. Imagine having an embryo developing in the tube, and the professional wants to use the vacuum aspirating, the mechanical option, to evacuate the uterus. There is no way that the vacuum tube that is used is going to be able to reach the tubes to bring everything out. It's not possible. And so it becomes waste. You go home and still the pregnancy is going to be there. The ideal thing is if it's an intrauterine pregnancy, sometimes if legally everything is well, everything is signed, and you will still want to go ahead with it, usually it has to be done in a hospital setting, especially in cases where the pregnancy is as a result of maybe some rape, some child abuse, and they want to get rid of it. It's actually for abortion, you have to go through a long process because I don't know whether now it's legalized, but then even if it's not, whether it's legal or not, in doing it, the right thing has to be done. So if it's legal and it is being done, it has to go through the appropriate steps. So if it's an ectopic, no one is going to put a tube inside a uterus to bring it out. If it's an intrauterine pregnancy, maybe they will consider either medical management or using the vacuum aspirate to do it. Then with the doing, we realize that a lot of young ladies decide to do it themselves at home without getting a scan or being examined by a health professional to find out where that pregnancy even may be. Sometimes the pregnancy is not even intrauterine, it's an ectopic, as we are saying. But because they don't know, they go and take some concoction, go and put a whole lot of things through their vagina into the uterus and cause a whole lot of problems. And for them, the least problem sometimes they get is getting infections. The worst of them is getting all this bleeding and all those things that come with it. Some die in the process. So we realize that sometimes you hear that some of these young girls are found bleeding, they are sent to the hospital, and within a short period, maybe we've lost the person. What happens is that maybe, just maybe, it's likely that it was an ectopic pregnancy. The person took some medication to abort it without consulting anyone, took some concoctions, put some things down there, and then the thing ruptures. And because they are doing it illegally, they hide themselves. Or maybe whoever is giving them the medication tells them that, oh, they will see blood. When they see it, they shouldn't panic. It's normal. For all you know, the person it's not the product of conception that is being aborted. For all you know, it's coming from somewhere where the pregnancy was, if it was an ectopic. And the person continues bleeding for days, and they are brought to the hospital in very bad states. Unfortunately, in our country, it's not every community where you get people, you get hospitals close to your neighborhood. So in some of them, they keep it, and the nearest facility they can go to is maybe a CHIP compound. In a CHIP compound, if you are sent there, by the standard of that CHIP compound, they cannot operate on you, and they have to also refer you to a bigger facility where the procedure can be done for you. So imagine you are in a village where the closest facility you get is maybe 30 minutes, and that's a CHIP compound. You probably bled for like 2-3 days already before being sent there. You get to the CHIP compound, and they also diagnose or suspect that it's an ectopic, and they have to send you to another place that is maybe another 30 minutes away. And mind you, it's not like the moment you get there, you are going straight into the theater. Some procedures might be done. Some, like getting a card, getting medication, getting a consent. It's a whole lot of processes before you get into the theater. Even though it's an emergency, someone has to be there. The appropriate thing will still be done before you are taken in. So you go in, and before you realize, so much time has been wasted before you are put on the theater table. That's the reason why a lot of them either will lose their lives at home, will lose their lives on the way to the hospital, or will even lose their lives in the hospital. And it really won't be because the doctor failed to do the right thing. But the time of arrival is as important as the management, because if you arrive late, and in a certain to sometimes, imagine your normal hemoglobin, your normal blood level in a layman's term, your normal blood level should not be below 10. Okay, so imagine you bled so much and you are brought to the hospital, your blood level is somewhere around 3 or 2. We know that by all means we have to get blood for you. Sometimes if you are not lucky, getting your blood, someone with your blood group to give you that blood will take another long hours, sometimes days before you can get it. So might end up you cry herself, and then the facilities also available will end up causing a lot of problems for the imagine if you take this, it's one of two things. Either we are giving you the appropriate medication to clear it, even if it's an ectopic, and then with those ones you can't get it from an over-the-counter pharmacy to do that. Okay, either we are giving you are being managed medically or surgically. You just go in, take it out, everything is sealed. In the next 2 days you are out of the hospital, back to your normal life. You don't have any problem. You live like any normal person. It's safer and better that way than to stay at home, listen to friends, listen to some advertisements on radios and TVs, a whole lot of concoctions and some materials that, oh, this person has used it before it works, this person has done it before it works, before you realize you are losing your life. So it's something that's very important that we need to have a look at, and I hope that like in the appropriate time people will get more education into it, and everyone will live happily. Yeah, I don't know if there are any questions or anything we can answer them.
Yes, Doug. Yes, we have some questions here. And one comes from Peter Kwanzaa. Peter Kwanzaa, thank you for joining. Please, his question is, so I want to know, is there any side effect of ladies that take in excess POSTINO 2 after sex in the name of preventing pregnancy? Because what I know is for the whole year, they are allowed to take in only 2, but some of them take like 3, 4, 5, and 6, and even more. So I want to know if there's any effect, negative effect. That's the question.
Yeah, okay, yeah. So there are a whole lot of effects. Even for those who are taking it just one time, some of them take it just one time and they get some side effect. So imagine having a limit of 2 and taking about 6. Okay, the truth of the matter is that for POSTINO and all these other contraceptives that are available, they are hormone based. So what is in the POSTINO that we are taking is hormonal. Okay, it contains some of the normal things that are found in the ladies that regulates their menstrual cycle. So the idea of taking this contraceptive is to make the body feel like everything is normal and the person is about to menstruate. In that case, anything that goes in or any sperm that is going inside doesn't really get the chance to go and get fertilized. And on the other side too, it's not always the case that the contraceptive is even going to prevent you from getting pregnant. Some of them fail anyways. So, but then the idea in itself is that you are taking it not to get pregnant. And once you take it, your body is going to adjust itself to think that, oh, I'm about to menstruate, so you start shedding off the blood. Whilst you are shedding off the blood, it means that even if there is any fertilization or anything, that embryo that is formed will not get anywhere to attach to in the uterus for the normal pregnancy to continue. Because whenever a woman is after ovulation in their normal cycle, the uterus prepares itself as if it is about to receive a baby in there to make it grow. That's the reason why their uterus becomes thicker. They have a lot of this blood lining inside the uterus, so that whenever there is the, how do you call it, there is the formation of the embryo, it just passes through the tube, gets into the uterus, and start getting adequate nutrition. However, if it doesn't happen, then you see them having their normal monthly flow. Whenever you take this contraceptive and post pill, what it does is that it's just going to help you to produce more, regulate your cycle, to make it your body feel like there is nothing there. Okay, let's flush everything out. So you just continue having your normal cycle. The issue with having taking multiple of these contraceptives is that after some time, sometimes even taking just one distorts your whole cycle. So that for someone who used to have her period every month, maybe for 5 days straight, and they are aware of, they take it once, and for like 2 months, their period is not, they don't even see their period. Some also take just once, and for several days, the person continues bleeding instead of her normal 3-4 days. Some of them will bleed some can bleed throughout the month if it's not reported to the hospital. So there's a whole lot of side effects. Sometimes it's not even with regards to the number you are going to take. Sometimes just one contraceptive can mess up your whole cycle. Then what happens is that at that point, you are now going to, if you are in a childbearing age, maybe you are married with your husband, and imagine that you are not seeing your period for a whole year. Definitely you can't conceive. Because if you are not having your period, it means you are probably not ovulating for your husband's fluid to go and meet. First of all, having sex, because I know no one will be comfortable having sex whilst the person is bleeding. That is one. And secondly, even if your husband's sperm goes inside of you, you are already bleeding and it is washing away everything that is inside. So bearing a child becomes a problem, and you can't do anything about it. So it's a big problem if you are taking contraceptives like frequently, like every time taking contraceptive. It's a big concern to us, and it's not advisable that anyone will do that. I hope it's okay for.
Yes, Doc, thank you very much. And we have a top-up question from Peter Kwanzaa again. He said, one more question, please. Can anyone get eye problem during birth? Can anyone get eye problem during birth? That's
so eye problem during birth. So I think this is not in relation to the contraceptives or anything, right? So yes, there are some conditions that can cause eye problems during birth. Okay, some of them are as a result can be as a result of infection. Some STIs that are left untreated can cause a lot of eye problems for the developing child. And then some of them too can be during delivery. In any case, sometimes during the delivery, if it's a traumatic one, some might have some problems going on. If it's a traumatic one, it means anything can happen. Maybe some difficult delivery, some injuries, anything. If that will cause some trauma to the child, if it's affecting the eye, it can cause a problem to the eye. Some infections that are left untreated, like syphilis and all those other sexually transmitted infections, some of them actually are passed on into the amniotic fluid, where the child is taking nutrition, because the child is going to stay in the amniotic fluid till he or she is delivered. And imagine this infection going into the child. The child is still developing. All these infections around the child can cause a whole lot of problems to the child, not only to the eye. Some can affect the lungs, some can affect the heart, anywhere. So yes, it's possible to get, for children, some children to get some problems at birth. And in any case, there are some of them also that might not only be with the infection, some can be with radiations. Women who stay around areas with high radiations are exposed to the child coming out with some defects, if it's so much. And that's the reason why in most cases, some women are not advised to be taking x-rays during pregnancy. It is not contraindicated, because let's say a woman is pregnant and she gets a fracture, we definitely have to take an x-ray to ascertain where it is, but it has to be limited. But in cases where the person is constantly exposed to the radiations, some of them can affect the child. By the time the child is born, you see some birth defect with the child.
Okay, Doc, thank you. We have another question here from Sam Womani. It says, if a woman gets pregnant for the first time at the age of 40, can there be some complications? If a woman gets pregnant for the first time at the age of 40, can there be any complications? Thank you.
Can you repeat it? The line wasn't clear enough.
The question is, if a woman gets pregnant for the first time at the age of 40, I don't know whether you can hear me.
I can hear you. You said if a woman gets pregnant for the first time at the age of 40. Your microphone is off.
Mm-hmm. Hello? You can hear me?
Yeah, I can hear you.
Said, okay. If a woman gets pregnant for the first time at the age of 40, can there be some complications?
Yeah, sometimes there can be some. It's not always constant that once a woman is having a child at the age of 40, she's going to have problems. It's not it's not the case. A 40-year-old woman can have a normal child. Okay. For complications, I mean, they just increase with age, because an 18-year-old girl can have a child with some complications, can have a child by herself, also have some complication. A 20-year-old, a 30-year-old can also have a child and still see some complication. However, the issue is that by the advancement with advancing age, the risk of having those complications increase with age. Okay, so if at if let's say at 20 years you have 10% chance of getting some complications during birth, either on the mother or on the child, by 40.
Thank you for watching. Like, comment, share,
and click on the subscribe button below. Thank you.